Do statins cause brain fog? It's actually one of the more controversial adverse effects associated with statins. So today we'll take a look at that. Stay tuned. The first thing we have to address is what even is brain fog? It's very subjective and it's hard to define. So I found this on a website called Everyday Health, and they gave a definition of brain fog. First, as given by a doctor with the Cleveland Clinic, brain fog isn't something that doctors diagnose their patients with. It's a broad term used to describe common cognitive symptoms that folks face. These can be varied, but generally center around the idea that your thinking or memory isn't as efficient or effective as it used to be. I found this to be really an inadequate definition. It is kind of clinical, but I felt that the brain fog that I had from statins was much more than this. But this article did go on to say that brain fog is commonly described as having fuzzy thinking, feeling scatterbrained or less mentally sharp, or feeling as if you're in a daze or your thinking is cloudy. And that's the part that I resonate with it. I always felt like I was in a daze and that I was making mistakes that I definitely should not have made. Problem is, when they go to measure these things, this is very difficult to measure. It is very subjective. Doctor can't get into your brain and detect the daze that you feel you're in. And in fact, you may do perfectly well on simple cognitive tests. I could probably, even when I was in this condition, done simple calculations and it would be totally undetected that I actually had an altered cognitive state. Okay, fine, so brain fog exists, it's subjective, but it exists. But can statins cause it? From this article that was on a website called Genetic Lifehacks, Statins and Brain Fog, exploring how statins impact memory and cognitive function. They pointed out that the second most common complaint of statin users are cognitive effects. My viewers would probably guess that the most common complaint is actually muscle symptoms, and that turns out to be the case. This article went on to explain in a little more detail. The brain contains approximately 25% of the body's cholesterol. A quarter of the body's cholesterol is in the brain. The brain is actually only about 2.5% of the body's total mass, perhaps, maybe a little bit less, maybe a little bit more. The blood-brain barrier doesn't allow circulating cholesterol to pass through easily, so the brain is actually not getting cholesterol from the bloodstream. It is a common misconception that endogenous cholesterol, in other words, the cholesterol produced by our body, is only produced in the liver, and that's not the case. The brain actually has to synthesize all the cholesterol, or most of the cholesterol that it needs, because it cannot get it from the liver because of this blood-brain barrier that is apparently effective in keeping most cholesterol out. And in case you're wondering, statins can cross over the blood-brain barrier. Hydrophilic statins such as Crestor, rosuvastatin, actually do have a harder time. Atorvastatin, which is Lipitor, the most commonly prescribed statin, it's also the one in which the cognitive adverse effects are reported most commonly, and that is lipophilic, fat-soluble, and that can cross over the blood-brain barrier much easier than, say, Crestor can. The FDA actually added a safety label information for statins in 2012 that includes the cognitive adverse events, and we're going to take a look at that in more detail in a little while. So why is this so hard to identify that somebody is having cognitive effects from their statins? Other than the very subjective nature of brain fog itself, it's actually not well known apparently among physicians. So in this paper, Physician Response to Patient Reports of Adverse Drug Effects, we get this data. They had a survey of 650 adult patients who are taking statins with self-reported adverse drug reactions. Okay, self-reported. Key there, and there's a reason they were self-reported. The most commonly cited adverse drug reactions: muscle symptoms, we expect that, cognitive symptoms, and neuropathic symptoms, the numbness in the extremities. And I believe this is where we find that the cognitive symptoms are the second most commonly reported ones. That actually surprised me a little bit. Well, what was the result when they surveyed these 650 people? 87%, that's about 7 out of 8, spoke to their physicians about the connection between statins and symptoms. Interestingly, patients usually initiated a discussion. They went to the doctor with a particular symptom. The doctors rarely actually raised it. When it came to cognitive effects, only 2% of the doctors said, oh, you have these effects that could be caused by statins. With neuropathic effects, it was only 4%, not much better. For muscle effects, it was still only 1 out of 7 doctors said, oh, this muscle pain could be caused by statins. Out of all these figures, the one that surprises me the most is this one, the one that only 1 out of 7 doctors associated new onset muscle complaints from their patients with the fact that they were on statins. That just blows my mind, because this is a well-known adverse effect of statins, And doctors aren't even paying attention to that. So we know they're not going to be paying attention to cognitive effects because they can't even recognize something as obvious as muscle symptoms that are sitting right in front of them. And I've seen videos of doctors being interviewed and they'll say, well, anybody can have muscle pains. That's not what's causing it. That's the attitude that we're up against. And we're going to actually look at that attitude a little more in a short while. Physicians were more likely to deny than affirm the possibility of a connection. You would expect that when the few cases where the doctor actually brings up there's probably a connection, they probably don't deny it. But I would think that the overwhelming majority of the rest of the time, doctors are denying it. My doctor had always said, oh, statins don't cause that. Here's a tip for the unusual doctor who may be watching this video. Get rid of the phrase statins don't cause that. Get rid of that from your vocabulary. It's disrespectful for the patient. So even if you don't think that an adverse effect is caused by the statins, it's always a possibility. These are complex chemicals that can impact our bodies in many different ways. Please get that phrase out of your vocabulary. But there is, of course, mainstream opposition to the idea that statins can cause cognitive effects. And there was a report about a genetic study, hints at cognitive impact of statins. This paper was not published by TCTMD, but they did report on it, and they actually interviewed some independent scientists and researchers on the results of it. From what I could tell, the report itself was really not that strong. They were just saying there's a possibility that there is a genetic component to this. But here's the response that we got. The reaction from a doctor not involved in the study. I said that despite the overwhelming safety and efficacy data with statins, we'll come back to that, there remains a group of statin deniers. I agree there are statin deniers, but I think it's actually the doctors who are pushing statins are quite often statin deniers in the sense that they deny the adverse effects, who argue that drugs cause harm. Well, the drugs do cause harm, maybe not to everybody, and that's the crux of the argument, I think, there, but to a considerable number of people. And then he goes on to say, I worry this manuscript will result in significant public health harm. So once again, what we're seeing is the population study, the public as a whole versus the needs of the individual. So this overwhelming safety data, despite that there's 10 to 30% of patients are statin intolerant, and I think it's probably closer to 30% than 10, but even 10%, that's not overwhelming if it's only 90% safe. The numbers needed to treat are in the double and triple digits. That's not overwhelmingly efficient. Granted, if you watch my last video on NNT, where I described the difference between statin drug effectiveness and statin therapy effectiveness, and it comes down to the fact that we can't identify the people very precisely who actually can benefit from statins. So I think that's where the heart of the problem is in this disagreement. He goes on to say, I think there will be people who see this when it's reported in the media and will want to stop taking statins. I'm going to come back to that point. That's not a good outcome. I guess we're just going to agree to disagree on that one. People will only read the headlines and are not going to do a deep dive. That is true. I will grant him that. People just read the headline that says, there's a genetic study that says that statins can affect me cognitively. There's a little bit of fantastical thinking here because, in fact, this is my personal experience. This is not from any kind of formal study or survey or anything like that, but I talk to a lot of people who are on statins, and a lot of people sympathize with me. They say, oh, wow, yeah, I had that problem too, so I got off them. There's actually probably more people out there say, oh, you had those symptoms with statins? That's really too bad. I don't have any problem with them. And they shrug it off. My boss at one of my jobs said, oh, I take statins, I have no problem. People who are on statins and don't have adverse effects, they're not looking at headlines and saying, oh, I'm going to stop now. They're blissfully happy with the fact that their statins have reduced their cholesterol because they've been taught that that needs to be done. Such reports aren't going to have any impact on people who aren't experiencing adverse effects. Some people will be alerted to the possible connection between their symptoms and what the statins are doing to them. A couple weeks ago, I had a brief video. I identified 4 groups of people who are statin users. First, there's users who don't have adverse effects. I'm not really concerned about helping them. They're not seeking any help. Then there are users who don't recognize that some of their health problems are caused by statins, and these are the people who concern me the most. These are the people who I want to help realize that statins may be the cause, and the key word is may, but statins may be the cause of a lot of the health problems that they're experiencing. The third group are those users who can't convince their doctors of the connection or that their symptoms are real at all. I mean, doctors just poo-poo, statins don't cause that. And then, of course, there are the users who, like myself, have decided to quit statins. And then, like I said in that other video, I've been through all 4 of these groups. I migrated from the top to the bottom as time went on. So let's take a look at what the FDA has to say. And this is from their website, and this is the safety announcement having to do with statins. So we can see here adverse event information about the potential for generally non-serious and reversible cognitive effects, memory loss and confusion have been reported. We can argue with the non-serious. Reversible, that's good. Statin drug labels have been revised to provide patients with more information on the safe and effective use of statins. Patients should be aware of the following. Memory loss and confusion have been reported with statin use. These reported events were generally not serious and went away once the drug was no longer being taken. Those are two things are separate issues, and I disagree with one, and I'm glad to hear about the other. There have been rare post-marketing reports of cognitive impairment, memory loss, forgetfulness, etc. associated with statin use. Onset can be from 1 day to many years. Healthcare professionals should report adverse events involving statins to the FDA MedWatch program using the information, etc., etc. Then they go on to talk about cognitive adverse events, the data on it. FDA reviewed their adverse event reporting database in the published medical literature. The post-marketing adverse event reports generally described individuals over the age 50 who experienced notable but ill-defined memory loss. But notable, I think, is good. And then they talk about the time to onset. And again, they go on to say that data from the observational studies and clinical trials did not suggest that cognitive changes associated with statin use are common or lead to clinically significant cognitive decline. So here's my take on it all. Because brain fog is subjective and not easily measured, many doctors and researchers just don't take it seriously, and doctors won't report it when a patient complains of it. And I suspect that even if they do think there's a connection there, doctors may be hesitant to report it anyway. I don't know what the reporting mechanisms are within an office. We know that there are databases they can go to report these things, but do they? I don't know. But doctors need to take it seriously. It's not just an annoyance to be tolerated. It can lead to serious consequences and serious degradation in the quality of life. The FDA calling it non-serious, that's an opinion. That's not a scientific fact. That's an opinion that is non-serious. Well, walking around a daze can easily be serious. It depends on what your life situation is. If you're working in a field where there's safety equipment that has to be used properly or machines that have to be secured properly when you're done using them, that can lead to serious injury. Maybe not the brain getting injured. Yeah, it's not seriously damaging the brain, though I think it must be. If that leads you to kill yourself through some other means, well, then that's not very safe. That's what I've got on this topic. If you appreciate this content, please like, share, subscribe, and comment on this topic or any others you'd like me to cover. And if you haven't seen this video, I recommend you take a look at it now. Thanks for listening.